Every 4 minutes, someone over 50 walks out of a doctor's office being told their colon cancer could have been caught a year earlier. 1 year lost because the warning signs looked like normal aging. There's a simple body check you can do tonight. Takes less than 30 seconds that tells you more than most people learn in a full physical. That knot in your stomach loosens. That quiet fear you carry every time something feels off in your gut replaced with real answers. I've ranked the most alarming warning signs from the ones that fool almost everybody to the single deadliest red flag you must never ignore. And that number one sign, research shows it gets mistaken for something harmless in 63% of patients over 55. Nearly 2 out of 3 missed. Right now, you might be sitting with a change in your body that you chalked up to stress or a new medication or just getting older. Something hiding in plain sight that your body has been trying to tell you for weeks. And the scary part, the standard screening advice most doctors still follow was designed for a pattern of this disease that no longer matches reality. By the end of this video, you'll understand why your gut has been warning you and why everything you were told to watch for was wrong. After 50, your colon's cell turnover, the speed it replaces its own lining, slows by nearly 40%. Your colon lining is the barrier that keeps waste out and nutrients in. When it weakens, damaged cells that should have been flushed out start hanging around. Tiny growths called polyp form in silence. Inflammation builds and the environment inside your colon shifts from protective to dangerous. Micromutations start piling up in those weakened patches. You can't see them. You can't feel them. But they're multiplying quietly every single day. The medical establishment will tell you to get your colonoscopy, eat more fiber, and watch for blood in your stool. Those things matter, but they're treating this like a checklist, not addressing the silent cellular breakdown that starts years before any test catches it. Certain warning signs force your body to reveal exactly where abnormal cell growth is happening. Not through some vague gut feeling, through basic physiology confirmed in over 1,000 clinical studies. Your body throws off specific signals when polyp and tumors interfere with normal function. I'm talking about mucosal disruption patterns. How a growing mass disturbs your colon's inner lining like a rock dropped into a calm stream, changing the flow of everything downstream. Absorption, motility, even your blood chemistry can shift by 30 to 45% before a single symptom feels serious. The mystery fatigue makes sense. The bathroom changes click into place. The bloating you blamed on dinner tells a completely different story. But not all warning signs carry the same weight. Some are misleading and send people into a panic over nothing. Some look harmless but are hiding something dangerous underneath. And a few are absolute red alerts that cost you nothing to check but could save your life. Warning sign number 12, unexplained nausea or vomiting. A review in the World Journal of Gastroenterology found nausea appeared as a noticeable early symptom in only about 8% of confirmed colorectal cases. 8%. The reason is simple. Nausea from colon cancer usually means something is physically obstructing your digestive tract. That's not early, that's late. By the time a growth is large enough to make you nauseous, other louder symptoms would already be screaming at you. Think of nausea as a confirmation signal, not a detection signal. If you're experiencing unexplained nausea more than 3 times a week for 2 weeks straight with no dietary or medication cause, write it down. Track it. But don't lose sleep over this one alone. Score 2 out of 10. Warning sign number 11. New onset lower back pain that doesn't match your spine. Advanced tumors can refer pain to the lower back. That's real. But as an early warning, minimal. A study in the European Spine Journal found that when patients presented with new lower back pain, fewer than 1 in 200 had a colorectal origin. The vast majority had degenerative discs, arthritis, or muscle strain, things practically universal after 60. By the time a tumor causes back pain, it's usually pressing against sacral nerves near the base of your spine. Late-stage territory. If your back pain is new, doesn't respond to position changes, and worsens at night lying flat, that specific combination deserves a conversation with your doctor. Score, 3 out of 10. Warning sign number 10, a sudden change in gas pattern or odor. Nobody wants to talk about this. That's exactly why it gets missed. When a polyp or mass develops, it disrupts your local gut bacteria. A study in the British Journal of Surgery found measurable shifts in gut bacteria composition up to 18 months before colorectal diagnosis. One of the first things that changes your gas. We're not talking about one rough evening after a heavy meal. We're talking about a consistent shift, sharper smell, more sulfuric frequency that flipped, constant when it used to be occasional, or trapped and bloated when things used to move freely. The problem. This sign is maddeningly nonspecific. Antibiotics change your gas. A new diet changes it. Stress changes it. If your gas pattern shifted and stayed different for 3 or more weeks with no explanation, note it, but don't build a case on this alone. Score 3.5 out of 10. Warning sign number 9. Pencil-thin or ribbon-like stools that won't go back to normal. When a mass narrows your colon's passage, stool squeezes past it and comes out thin. A study in diseases of the colon and rectum confirmed persistent narrow stools in about 18% of patients at diagnosis. But thin stools happen for a dozen other reasons. IBS, muscle spasms, low fiber, stress, and the anxiety this sign triggers often does more harm than the sign itself. The key word is persistent. One odd stool means nothing. A week after a dietary change, probably nothing. But pencil-thin stools lasting 3 weeks or more that don't respond to fiber or hydration, that earns a call to your doctor. Score 4 out of 10. Warning sign number 8, feeling full after eating very little. The medical term is early satiety. You sit down, take a few bites, and feel stuffed. A study in the American Journal of Gastroenterology found early satiety in roughly 22% of patients with right-sided colon tumors. The mass interferes with gastric emptying, sending full signals to your brain when you've barely eaten. Most people over 60 rationalize it. My appetite's just shrinking with age. Sometimes that's true, but age-related appetite loss is gradual over years. Tumor-related satiety shifts over weeks. If your food intake dropped noticeably over 4 to 6 weeks and you're not dieting, especially if you're also losing weight without trying, that combination matters. Score 4.5 out of 10. Warning sign number 7, fatigue that sleep doesn't fix. This sign is more important than most videos give it credit for. If you're over 50, you're probably tired. Arthritis meds, blood pressure pills, poor sleep, they all drain energy. So, hearing fatigue is a warning sign, feels useless. Here's the filter that changes everything. Normal aging fatigue has a rhythm. You're fine in the morning, dip after lunch, recover by evening. Tumor-related fatigue is flat. It sits on you all day, morning, afternoon, night. 8 hours of sleep doesn't dent it. A study in the Journal of Clinical Oncology found that cancer-related fatigue driven by inflammatory cytokines and hidden blood loss was described as unrelenting by 68% of patients. It doesn't respond to rest because rest isn't the problem. Your body is fighting something and burning fuel you can't see leaving. If your fatigue changed character, not just got worse, but changed, and no medication adjustment explains it, that's the signal. Score 5 out of 10. Warning sign number 6, mechanical constipation that laxatives can't clear. Constipation after 50 is so common, nobody thinks twice about it. Blood pressure meds cause it, calcium supplements cause it, pain medications cause it. You take a laxative and move on. But here's the distinction most doctors never explain. Medication constipation started when you started a pill. You can trace it. Mechanical constipation caused by a physical mass partially blocking your colon doesn't have a trigger. It creeps in and laxatives struggle to fully clear it. A clinical review in Gut Journal found that patients with obstructing tumors reported a specific pattern. Incomplete evacuation even after laxative use, alternating with sudden loose stools as the blockage partially clears. That back and forth is the key. If your constipation doesn't match a medication timeline, doesn't fully resolve with laxatives, and flips between blocked and loose, pay close attention. That's your colon telling you something is physically in the way. Score 6 out of 10. Warning sign number 5, unintentional weight loss with no diet change. This is when your body sends signals you can't rationalize away. Dropping 5 or more pounds over 6 to 8 weeks without changing what you eat or how you move. That's your metabolism responding to something it shouldn't have to. A study in the British Medical Journal found that unexplained weight loss in adults over 60 carried a cancer probability of roughly 1 in 7 when combined with even one other symptom, 1 in 7. Growing tumors consume energy. They trigger inflammatory cytokines that accelerate muscle breakdown. Your body burns reserves it shouldn't be touching. Clothes fit differently within weeks. The face looks thinner. Energy drops alongside the weight. If the scale is moving down and you didn't change anything, especially alongside any other sign on this list, don't wait. Score 7 out of 10. Warning sign number 4, a persistent change in bowel habits lasting more than 2 weeks. This sign is criminally underrated, not because it's obscure, but because it's so broad that people dismiss it. Your colon has a personal rhythm, a pattern it's kept for years, maybe decades. When that pattern breaks, not for a day, not for a weekend after a bad meal, but for 2 solid weeks, your colon is telling you something structural changed. A prospective study in the Annals of Internal Medicine found that a sustained change in bowel habits was present in 38% of colorectal cancer patients, and it was often the first symptom they noticed. Months before anything else. The change can go either direction. More frequent, less frequent, urgent when it never was. Track it with a simple note on your phone each day. 2 weeks of a clear pattern shift earns a colonoscopy conversation. Score 8 out of 10. Warning sign number 3, the drip test. Dark blood mixed in the bowl versus bright red on the paper. Blood in the stool gets talked about in every colon cancer video ever made. And almost all of them say the same useless thing. It's probably hemorrhoids, but see your doctor. Thanks for nothing. Here's what they should be telling you. 3 clear differences between hemorrhoid bleeding and tumor bleeding, and you can assess them yourself. First, timing. Hemorrhoids bleed during or right after straining. Tumor bleeding is often random and silent. Second, color and location. Bright red blood on the toilet paper usually means a surface-level source near the exit. Dark or maroon blood mixed into the stool or swirling in the bowl suggests a deeper source. Third, stool changes. Hemorrhoids almost never change the shape of your stool. A tumor often does. Dark blood in the bowl, not on the paper, especially with stool shape changes. That's not a hemorrhoid pattern. That earns an urgent call. Score 8.5 out of 10. Warning sign number 2, abdominal cramping or pain that keeps returning in the same spot. This sign is more diagnostically powerful than nearly everything else on this list. Because of one word, location. Random belly pain moves around. Gas pain drifts. Meal-related pain fades after digestion. But tumor-related pain returns to the same spot again and again. A major review in the Lancet Oncology found that localized recurring abdominal pain was present in over 42% of colorectal cancer patients, and in most cases it preceded diagnosis by 3 to 6 months. 3 to 6 months of the same ache in the same place that kept getting dismissed. When you map it, touch the spot and it's always there, always that same quadrant, your body is pointing at the problem. If you commit to paying attention, same spot, same pain, returning weekly or more, this sign alone justifies a colonoscopy. Score 9 out of 10. Number 1, iron deficiency anemia after 50 with no investigation of the gut. This is the sign that gets missed more than any other and the one that could save the most lives. If you are a man of any age or a woman past menopause, you should not be developing iron deficiency anemia. Period. You're not losing blood through menstruation anymore. So, if your iron is dropping, your body is losing blood somewhere you can't see. And the most common hidden source, your colon. A slow bleeding polyp or tumor can leak tiny amounts of blood into your stool every single day. Amounts too small to see but enough to drain your iron stores over weeks. A landmark study in the British Medical Journal found that iron deficiency anemia in adults over 50 was associated with a colorectal cancer detection rate of nearly 1 in 10. 1 in 10. And here's what makes this the undisputed number one. In far too many cases, doctors see low iron, prescribe supplements, and never order a colonoscopy. A review in Elementary Pharmacology and Therapeutics found this happened in nearly 60% of cases. Your iron comes back up, you feel better, and the tumor keeps growing in silence. If your doctor has ever put you on iron pills without investigating your gut, especially after 50, have that conversation now. Not next month, now. Score 10 out of 10. Ask your doctor for a complete blood count and an iron panel at your next visit. If you're over 50 and your ferritin is below 30 nanogs per milliliter, especially if you're a man or a postmenopausal woman, do not accept iron supplements as the full answer. Request a colonoscopy. Say these words. I want you to investigate the source of the iron loss, not just treat the number. Most doctors will respect that. If they push back, get a second opinion. This blood test costs as little as $20 to $50. Some insurance plans cover it fully. The test takes minutes. Results take days, but what they reveal could change everything. One warning. Some doctors will say mild anemia is normal for your age. After menopause or for men at any age, iron deficiency anemia always deserves investigation. Don't let anyone normalize it. If you're already taking iron supplements, don't stop them before your blood test without asking your doctor. Stopping abruptly can skew results. But for the vast majority of people over 50 with unexplained fatigue and low iron, pushing for a colonoscopy is the single most important step you can take. Start with the number one action. Get that iron panel. Do it this week, not next month. Begin tracking your bowel habits daily. A simple note on your phone. Time, consistency, anything unusual. Takes 10 seconds. Add the number 3 drip test. Check the bowl and the paper every time. Just look. Cost nothing. Takes 2 seconds. Within 3 days, you'll notice patterns you were blind to before. Within a week, you'll have a clear baseline. Within 2 weeks, you'll have enough data to walk into any doctor's office and say exactly what changed and when. Within a month, you'll either have complete peace of mind or you'll have caught something early enough to do something about it. Don't make these critical errors. If even one sign from the top 5 shows up and persists for 2 weeks, that alone justifies a call to your doctor. Don't let embarrassment stop you. The signs on this list involve bathrooms, blood, and body changes nobody wants to discuss. That silence is exactly what lets cancer grow. Don't expect your doctor to ask. Most routine physicals don't cover stool shape, gas patterns, or fatigue quality. You have to volunteer that information. Don't stop prescribed medications or screenings based on this video. This is awareness, not a replacement for medical care. And don't dismiss a pattern because one day looks normal. Cancer signs don't show up every day in the early stages. They come and go. It's the trend over weeks that tells the truth. Track the trend. Trust the pattern. Your body wants to protect you. Your colon sends signals when something is wrong. It always has. But it needs you to listen. For decades, you've been told cancer is random. That it strikes without warning. That there's nothing you can do except show up for a screening every 10 years and hope for the best. That's not the full truth. It's detectable. It's catchable. But you have to know what your body is actually saying. These 12 warning signs are your body's own early detection system. Specific changes that show up weeks, sometimes months before any scan would catch a problem. You're not powerless. You're underinformed. And that's not your fault. Commit to tracking your body for 30 days. Every bathroom visit, note what you see, color, shape, anything unusual. Check your energy levels each morning. Write down any pain that returns to the same spot. Rate your fatigue on a simple 1 to 10 scale. Start a note on your phone today. Date it. Within 30 days, you'll have something no doctor can give you in a single appointment. A complete picture of what your body has been doing. Take that record to your next visit. Ask for a complete blood count and an iron panel. Compare your 30-day log to the 12 signs in this video. You'll either have total peace of mind or you'll have caught something early enough to beat it. Your colon won't send you a louder warning than the ones you just learned. Start tonight. One note on your phone, one look in the bowl, one honest check-in with your body. Your gut will thank you. Your family will thank you. Let's fix this starting.